Introduction. Ceftaroline is a 5th-generation cephalosporin antibiotic known for its broad-spectrum activity. It is especially important because it has activity against MRSA, methicillin-resistant Staphylococcus aureus, which makes it unique among beta-lactam antibiotics. 2. Class and generation. Ceftaroline belongs to the 5th-generation cephalosporins. It works against both gram-positive and gram-negative bacteria, with enhanced binding affinity to altered penicillin-binding proteins, especially PBP2A and MRSA. 3. Mechanism of action. Ceftaroline works by inhibiting bacterial cell wall synthesis. It binds to penicillin-binding proteins, PBPs, and prevents cross-linking of the peptidoglycan layer, leading to cell lysis. Its ability to bind PBP2A gives it strong activity against MRSA. 4. Spectrum of activity. Effective against MRSA, MSSA, Streptococcus pneumoniae, including resistant strains, Streptococcus pyogenes, and agalactiae. Gram-negative bacteria like E. coli, Klebsiella pneumoniae. H. Influenza. Not effective against Pseudomonas aeruginosa, ESBL-producing organisms. CRE, carbapenem-resistant Enterobacteriaceae, anaerobes, limited. 5. Indications. Uses. Ceftaroline is primarily used for complicated skin and soft tissue infections, CSSTI, including MRSA, community-acquired pneumonia, CAP, off-label use in severe MRSA infections when other drugs fail, e.g., persistent bacteremia. 6. Dosage and administration. Usual adult dose, 600 mg for every 12 hours, infused over 5 to 60 minutes. Dose adjustment required in renal impairment. Duration depends on the type and severity of infection, 5 to 14 days typically. 7. Pharmacokinetics. Administered for only half-life, 2.6 hours. Eliminated primarily by kidneys. Good penetration in lungs and skin tissue. 8. Side effects. Common side effects: diarrhea, nausea, and vomiting, headache, rash, elevated liver enzymes. Serious side effects: hypersensitivity reaction. C. difficile-associated diarrhea, hemolytic anemia, rare. 9. Contraindications. Known allergy to cephalosporins. Caution in patients with penicillin allergy. Dose adjustments required in renal impairment. 10. Drug interactions. Ceftaroline generally has minimal drug interactions. However, caution is advised when combined with nephrotoxic drugs. Author: beta-lactams. Risk of hypersensitivity. 11. Special consideration. Safe in pregnancy. Category B. Use if needed. Not recommended in severe renal failure without adjustment in MRSA bacteremia cases, often used in combination with other agents for synergy.